With another special session of the Alabama legislature looming, cuts to Medicaid are being discussed by state lawmakers to address that multi-million-dollar budget shortfall. WVUA 23's Jack Royer is live in the studio with more on how Medicaid cuts could affect nursing homes in our state. Jack.
Philip, the number of Alabamians that rely on Medicaid might surprise you. The number of nursing homes that rely on Medicaid funding has some Alabamians worried about what possible Medicaid cuts could mean. While lawmakers prepare for another budget battle, Alabamians are worried about what potential cuts to Medicaid mean for them or their loved ones. At Heritage Healthcare and Rehab, they're worried too. Blake Jackson is the third generation in this family-owned and operated facility. Of this facility's 180 residents, over 120 of them depend on Medicaid to pay for their care from the nearly 200 employees. And nursing home employment is the area that experts say Medicaid cuts would hurt first.
The first thing you will see is staffing cutbacks. The individuals that take care of our residents on a day-to-day basis, you will see a reduction in that.
In the state of Alabama, 15,000 out of the state's 22,000 nursing home residents use Medicaid to pay for care. Wednesday, Governor Bentley expressed his concern on Twitter, asking, "What would you do if a loved one had to be removed from a nursing home because of cuts?" Experts tell me the cuts would likely be seen in a staff cutback before a resident would ever be directly denied care. The Alabama Nursing Home Association says that Medicaid shouldn't be on the table to cut spending.
You would see nursing homes close. You would see layoffs of nursing home employees in addition to the impact it would have on all other sectors of healthcare in Alabama.
For family-run and corporate-owned nursing homes alike, caregivers agree on one thing.
We need Medicaid fully funded. Right now we're operating on a marginal level. We need to make sure our legislatures do provide us with the financial means to take care of these elderly residents.
Caregivers on high alert as Alabama nursing homes try to stay healthy. Now, a budget featuring over $150 million cut from Medicaid was passed by the House but killed by the Senate at the last special session. We'll have to wait and see what lawmakers do at the next special session in September. Live in the studio, I'm Jack Royer, WVUA 23 News.